It's time now for our weekly segment with Dr. David Agus. He's ready to answer all your questions about COVID, monkeypox, and of course the horrific school shooting in Uvalde, Texas. And Doctor, thanks for joining us. We're going to actually sort of start with that, with the gun violence, because that is, I think, top of mind right now. After the mass shooting, like we saw in Texas, after many of them, people tend to blame mental illness. But the National Alliance on Mental Illness released a statement yesterday saying that that's not the case. What's your take on this? Is there a link between mental illness and gun violence? And I think I sort of understand why people might be hesitant, because most people who are suffering with mental illness are not outwardly violent.
I mean, obviously, mental illness is an enormous issue in our country. We have to get better at identifying it, at preventing it, and at treating it. We can't measure this thing called the brain. So when you can't measure something, it's very hard to figure out ways to deal with it. At the same time, gun control is a major issue in this country. And you cannot say it's all based on mental illness here. And I think that's what the National Alliance of Mental Illness is really referring to, is that we also have to get better at gun control. When a young individual, 18 years old, with still a developing brain, still can make rash decisions, can buy a weapon like this, and obviously use it, there's something wrong with our gun policy in this country. And we have to both address mental illness and gun violence. We have to do more research on both and understand them and treat them.
All right. Thank you so much for saying that. Let's get into COVID and the other sort of pressing news of the day. This question is coming from grandparents of a 1-year-old. They want to know when there will be news about the COVID vaccine for kids under the age of 5.
Well, we've seen both Moderna and Pfizer have announced that they have vaccines that work for under the age of 5, and they work dramatically well in the clinical trials. The FDA now has said they're going to review them on June 15th. So when they review them, it should be about a week or two afterwards. They should be available. By all inclinations, they will say yes. And so I would think that by the end of June, beginning of July, we should start vaccinating. And I know that date gets pushed, and I feel horrible that there's a group that's unprotected in this country.
Question from someone who has one kidney. They want to know if Paxlovid, which people use to treat COVID, I believe, at home, if it's safe for them to use.
Well, Paxlovid is an amazing drug because it clearly dramatically decreases the virus as soon as you start taking it, but it interacts with a lot of drugs. So the first thing is make sure you ask your doctor, does it interact with my cholesterol, medicine, my blood pressure, et cetera? Having one kidney is fine with Paxlovid and shouldn't be a problem in taking it. Because your body can function remarkably well on one kidney, but the drug interactions are what we worry about the most.
So I haven't heard this. This is a person who's wondering if NSAIDs, like ibuprofen, naproxen, if they increase the severity of COVID symptoms?
That's an amazing question. So, first of all, why do we get a fever when we get sick? Does it help us? Should you take a Tylenol or ibuprofen when you're sick, or does the fever help clear the virus? And the true answer is we just don't know. There is no evidence that taking Tylenol or ibuprofen or naproxen while you have COVID will make it worse at all. And there is no reason to not take it. So if you do feel bad and Tylenol makes you feel better, by all inclinations, take the NSAID or the Tylenol.
Finally, want to switch to monkeypox. This person wants you to explain just exactly what monkeypox is. Is it similar to chickenpox? Are all the poxes in the same family of diseases? I don't know.
It's very similar to smallpox, which was a disease that if you were born until the kind of mid-70s, you were vaccinated against smallpox. And we almost eradicated it from the globe. We did remarkably well in that regard. And then we just took vaccines and we stored them away. So we have over 200 million vaccines against smallpox stored away. And the good news is those smallpox vaccines will protect against monkeypox. Monkeypox is something that is spread through mainly touch of an open lesion. And so there was a festival in Belgium, and there were people who, brought it from Africa. So they got it from rats, carry it, not monkeys, unfortunately, or fortunately for the monkeys. And they were able to spread through touching those lesions to other people, and then they touch the lesion. So really, you have to have the lesions to be infectious, which is important. And it's not like COVID that changes all the time. We're worried about a new variant of COVID changing, and it's literally changing every day. We don't see that with monkeypox. So I think we're going to get a hold of this. There's a 3-week quarantine for people who have lesions. Once we start identifying and quarantine, we'll be able to get a hold of this and get this under control.
All right, Dr. David Agus, thank you so much. If you have questions about COVID-19 or other things, send them to Dr. Agus. You can tweet him at David Agus, or you can text him at 310-299-9322. We are going to have the doctor on actually every Thursday morning, so he might answer your question right here on the stream. We'll be right back.